Hello everybody. So let's talk today about the Diastasis Recti. So what is Diastasis Recti? The Diastasis Recti is the separation of the abdominal wall. We have a line here, right? This is the rectus, abdominis. This is the transverse abdominis. We have a tissue here, and also it's called linea alba. This is a connective tissue. When someone is pregnant, it's normal that this muscle expands and separates to give room to the baby. Also, after surgery, this is going to expand because it's connective tissue, and the connective tissue tends to expand. The problem is if the expansion was too much. What happens if the expansion was too much? There is going to be a bulge tummy. And that is when we have to pay attention. If we have a bulge tummy, that means that the back is not supported right, the core is not working right, the organs are not supported right. There is an imbalance in the core muscles. So it's very important to do things that are going to reduce that, I would say separation. So things that you want to do is to decrease the excessive pressure in the abdominal cavity. So because every time that you are sitting, for example, and leaning back like this, resting in the chair, your back is like a C. That back that is like this is, this is the stomach, is pushing everything out. So, and the separation is there, so the body wants to heal. Normally the body wants to heal, but if we put more pressure, the abdomen is not going to heal. So, something that I also avoid is doing crunches, because crunches increase the excessive pressure in the abdomen. So when you get up from bed, don't get up like that. Roll to your side, and then you get up. Everything, you are going to try to maintain, to prevent that get worse. So when you are sitting at work, I'm going to give you a very good tip that I do every day when I sit, is to sit at the edge of the chair. Instead of sitting like this, you're going to sit at the edge of the chair, because when you sit at the edge of the chair, your pelvis do this, right? Like this is going to do this. When you do the movement, you are going to activate the core muscles, so you really are working out the core muscles. So Diastasis Recti, there is a way to do a test, with your fingers. I'm going to show you a video later about how to test if you have diastasis. But one of the first things that you're going to notice is like the belly on the bottom that doesn't go away, and you say, what's going on? So that's one of the first signs, could be that, right? But with the fingers, there is a way to see if you have diastasis, and if that separation is more than 2.5 fingers, means that there is diastasis. So one of the best exercises for Diastasis Recti are the hypopressive. The hypopressive are amazing, because what you want to do in diastasis is to work on the transverse abdominis. What is the transverse abdominis? Transverse abdominis is a muscle that we have like this. It's a beautiful muscle that is like a corset. It's such a beautiful muscle that keeps everything in place. So when we do the hypopressive, we are going to activate the transverse abdominis. We are going to reduce the excessive pressure in the abdominal cavity. So I'm going to show you what happens. So you are standing, right? So here is the transverse abdominis. Here you have the rectus abdominis, right? So when we have excessive pressure, everything goes like this, right? But when the transverse abdominis is always working, the whole body is going to have a good posture, and everything is going to be more efficient when you move. So check it out what happens when you do hypopressive. Hypopressive is a combination of things. It's not just the breathing, okay? It's a postural sequence, rhythmical sequence that activate muscles, the right muscles, to make the core and the pelvic floor muscles work properly. And we work on the muscles that are involuntary. That means that when you have to go to the beach and you want a nice picture, you don't have to put the tummy in with so much effort, just you're going to be able to do it natural. Okay, so let me show you how hypopressive works. I'm going to move this chair. This is okay. So when you do hypopressive, you will see why it's so effective, because we're reducing the excessive pressure. And also, when you want to have some waist, how can you get waist when the transverse abdominis are contracted? So hypopressive, you focus on the posture, and we change the position of the hand many times, right? Why? Because when you change the position of the hands, you are activating a serratus muscle that's going to help you to relax the diaphragm. Okay, I have to tell you about the diaphragm before I keep going further. The diaphragm plays a special role in hypopressive, because the diaphragm is going to relax. And the diaphragm, when it's tight, okay, the diaphragm, imagine this is a house, right? So, here is the roof that goes all the way to the back. That's the diaphragm. The organs are going to be the family that lives there. Here we have a family, a teamwork. We have the intestine, we have the liver, we have the stomach, okay? And we have the bladder, the driveway, and then we have the pelvic floor, right? So it's like a house. If you think about it, it's like a house. But if the roof, that is the diaphragm, gets too tight, oh, I forgot. On top of the roof, we have the lungs. The lungs, but imagine if the roof gets tight, the poor lungs can expand. And you know what happened? Everything tenses up, the neck tenses up, because the lungs can expand, and also you get more hyper, more stressed out, because the diaphragm is everything. So we have to learn to relieve the diaphragm first. So the diaphragm, remember, is the roof. So you can feel it when you go like this. I feel my diaphragm there. You will feel like when you inhale, when I inhale, you feel like I push my fingers out. That's the diaphragm. Okay, so with the hypopressive method, what we do, we will in the diaphragm release, and it's very beautiful because the diaphragm is here. So the diaphragm is going to do this. So what is going to happen is also expand. When expand, the lungs are going to be able to expand. You're going to be able to have more air to your lungs, and you're going to be able to feel, you're going to have more energy, more lung capacity, right? Okay, so the diaphragm went up. What happened here with the organs? The organs are pushing down. The organs are pushing against the bladder and the pelvic floor. They're going to be able to breathe, and they're going to come up, right? So, and guess what? The transverse abdominis is going to be able to do what the transverse should be doing, to contract and give you that corset that we all have. And the best part is going to start bringing the rectus abdominis together. Okay? So, I will show you why it's important. So, another thing, when you do hypopressive, do it in an empty stomach, okay? Because, you are really working a lot here, right? And you can feel it more with an empty stomach, because you are going to really activate involuntary muscles, and also empty your bladder, because you don't want to retain urine. You're really working with a lot of things here when you do hypopressive. It's beautiful. Hypopressive is a beautiful method, and I love it so much, because I also do yoga. I am the doctor of physical therapy, and I'm always looking for the best thing to make my patients happy. And I start with myself to learn how to take care of myself, to be able to take care of others, right? I do Uddiyana Bandha, is the breathing in yoga, that's going to help you to open your heart, to make you more kind, to make you more compassionate. But also they do a method that moves everything like this, and it's going to help you with massaging the organs. So I combine both. I love them so much, because really help me to have a good posture, help me to maintain my core stronger. I need it for my job, you know, my job is kind of physical therapy, physical work. Okay, so let me show you, I want to show you how is hypopressive. Hypopressive, we're always working in postural muscles. The postural muscles are all from the neck all the way down, the one that keep you upright. So when you focus on that, you want to learn the posture. If you're pregnant, you can do the posture, but stay away from the breathing, okay? Because the breathing, you know, follow, do this with the hypopressive 75%. Okay, and don't get confused, you know, and now there is many things like a vacuum, stomach vacuum, like many different names, but you know why I follow hypopressive from Dr. Cafres? Because he studied women's health. He's a doctor that specializes in, you know, in the women's health, in the core, in the pelvic health, and he did so many research about what would be the best exercise to prevent urinary incontinence, and he came with the hypopressive method. And he trained physical therapists and doctors and nurses to help them out. So don't get confused, okay? Do it right, because then later you're going to say, why I'm getting like other symptoms? Is because sometimes we do it without good explanation. Okay, let's go to this. So you're going to go. This is a demonstration, but just I want to show you how important is the posture. Look at how I do with my shoulders. You know what I do, I put my hands, you know, the hands are pulling out. I go with a double chin, center of gravity forward. Why center of gravity forward? Because the pelvic floor muscle activates. Oh, a good way, I remember, to know if you have. Okay, I'm sorry, let's not confuse you more. We're talking about diastasis recti, and now I'm going all excited about this. Okay, so why so good? Look at that, what happened here. Pay attention to this right now. I want you to focus in this. Pay attention what happened here when I do hypopressive. Dun, 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 I go closer. You see what happened? Everything come in. Everything come together and soak up. I hope I'm talking right, you know, because it's hard because I speak Spanish, my first language. If you don't understand, please, I'm sorry about that. I'm trying to do my best. So let's do it again. So check it again. Check what happened. So, you know, posture is very important. Lean forward because activate the pelvic floor. Actually, I'm going to move it like that because I feel that is less. Let me see. Dun, 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 right there. Okay, let's cover this. And I'm going to do it one more time. You know, it's something very good about hypopressive. You know, when you are starting, you do every other day. Why it's so important to do every other day? Because according to Dr. Cafres, the brain needs to rest because we have an amygdala here in the brain that is the one that stores all the emotions and trauma and pain. So when we sleep, we release the information and the new information is digested. So it's very important to sleep well too, okay? Okay, let's do it again. Oh yeah, how anything. Oh, very good. So this is hypopressive, and you see how this come here, right? Because I'm activating the corset, and you see everything come together. So you see here it's all reflex. So when you do hypopressive, you will feel like your posture improve right away. It's a beautiful, beautiful, beautiful. But you see results after 6 weeks of keeping this beautiful method. And look at what is Uddiyana Bandha. Uddiyana Bandha is an amazing method too. It's amazing, but I'm going to bring this down so you can see more. Okay. When you do, actually, you know what I'm going to do? Let me see if I can bring it. Maybe I can put it like this. Dun, 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 dun. Dun, dun, dun. So check it out what happens when I do Uddiyana Bandha. When you do Uddiyana Bandha, you always stay in the same posture. You can do it sitting or you can do it like this. Uddiyana Bandha, I love to do it in the mornings because it's when, in the empty stomach, to massage my stomach and also to have a good BM. If you don't know what is a BM, it's about movement. Okay, let's do this. So my hands, exhale. Let's do it again. Okay. So this is a good way, when you learn hypopressive. I will teach you also Uddiyana Bandha because I feel it's, has helped me so much with constipation. I have dealing with constipation all my life. And when I do Uddiyana Bandha, it's perfect. Help me with my digestion. Okay, my sweet people, I hope you enjoyed this video about Diastasis Recti, about what is the best exercise for diastasis, hypopressive, and also Dhyana yoga. Why not? Good combination. What you should not be doing. Remember, everything that increases excess of pressure in the abdominal cavity. That means don't sit like a sit at the edge of the chair. Okay? Have a beautiful day. Thank you for watching this video. I love you all. And don't forget to subscribe to my channel. I'm preparing something amazing, a transformation for the core. Please keep following me.